This is a PowerPoint presentation on stroke. So looking at the pathophysiology of stroke, we have something that involves a sudden interruption of the blood supply to the brain, whether that be from a blockage or a rupture. And this can lead to tissue damage of the brain, leading to neurological deficits. So when we have a patient experiencing a stroke, that is an emergency situation. So our priority is always going to be to assess their airway, their breathing, their circulation, along with taking a focused history assessment, and it should always be conducted. The NIHSS is the standard tool for assessing patients after a stroke. So this can tell us, what kind of symptoms they're exhibiting and what nursing interventions we will then complete. So this is going to include assessment of their level of consciousness. Can they follow commands? Do they have any facial palsy? Things of that nature. And then we also want to look for common signs and symptoms of stroke. So this can include numbness or weakness of the face, change in mental status. We also have this acronym, BFAST. So with that, we want to check, see, is the patient losing their balance? Are they having difficulty with their eyes, their vision? Is their face symmetrical? Is one side drooping? Arms. So we can have our patient lift their arms up and see if there's an arm drift. Speech. Can they speak correctly? Can they understand our speech? Is it slurred? And then lastly, time to call 911 if you are not in a hospital setting, and time is brain. So when someone comes in with stroke-like symptoms, we want to be able to get them into a diagnostic apparatus sooner rather than later. So this can include computed tomography for perfusion, computed tomography angiography, that can assess for ischemia of the brain tissue. And then we also have magnetic resonance angiography and magnetic resonance imaging, which can help identify arteriovenous malformations leading to the brain ischemia. Now, for our nursing interventions, we want to observe for neurological deficits with frequent and serial neurological assessments. We want to measure and monitor the pupil size. Are they equal? On both sides the same? We want to monitor vital signs. We want to provide a quiet environment with the head of the bed elevated. We also want to elevate the bed rails to prevent falls. We want to make sure that if our patient needs us, that they are able to contact us and make sure that they have their call bell with them. We do not want these patients straining, so we can provide stool softeners to prevent constipation and straining during bowel movements. We want to watch for seizures. We can implement seizure precautions. Look for any changes in mood. Was your patient fine and now they're kind of out of it? We want to provide DVT prophylaxis, whether that be, heparin, Lovenox, and then we want to collaborate with the speech therapist for a swallow evaluation to see if it's safe for our patient to eat or drink. If our patient is coming in with a massive clot leading to an ischemic stroke, we can implement fibrinolytic therapy or endovascular interventions. So the main drug used in the US is known as alteplase, and this is time sensitive. It must be administered within 3 hours of the onset of symptoms, or 4.5 hours if the patient does not meet one of the contraindications set forth by the American Stroke Association. We can also have surgical interventions like an embolectomy, in which a clot is retrieved and removed, and then a stent is placed to relieve that blood flow. Once our patient is stabilized, it is then our job to educate them about what has happened to them. So a stroke is caused by an interruption in the perfusion to the brain. So we want to give them the tools to be able to help prevent further strokes because they are now at risk. So stroke prevention can include smoking cessation, limiting saturated fats, eating fruits and vegetables, and getting regular exercise. Just really good lifestyle modifications. Conditions that can lead to a stroke. So they may have coexisting conditions such as high blood pressure, obesity, substance use, AFib. They could have high cholesterol, carotid stenosis, or diabetes. So it's important for them to manage these conditions in order to reduce their risk. The American Heart Association also recommends following the FAST acronym, kind of as we spoke earlier, just so they can teach themselves or their family and friends to recognize the signs of a stroke so that they can bring them in for prompt intervention. So looking at some population-specific considerations, The American Heart Association states that Black Americans are more at risk for stroke, and this is due to an associated higher risk of those comorbidities that can lead to a stroke, such as high blood pressure, diabetes, and obesity. There's also an increased risk to the Hispanic population, and this is due to limited public health information availability in Spanish. Also, being over the age of 60, so our older clientele, that's going to increase the risk of stroke, but anyone can have a stroke, and this includes children and babies. And also, clients with low socioeconomic status are also at a higher risk for stroke. They oftentimes, unfortunately, receive lower quality care and experience poorer outcomes due to inadequate control of their cardiovascular risk factors, exposure to increased particulate air pollution, and disparities within the healthcare system. So that is our PowerPoint presentation on stroke. Now you can test your knowledge by playing this Kahoot. So if you click on the link, and I hope you enjoyed it. Thank you.